Organochloride poisoning is totally different from organophosphorus poisoning, because in organochloride poisoning the mortality rate is very high comparatively organophosphorus because of the non-availability of specific antidote as atropine in organophosphorus. Moreover, organochloride poisons are highly toxic, they are volatile, they have broad spectrum of absorption, they can be taken orally absorbed. Some poisons are even absorbed transdermally. They have broad spectrum absorption. They are highly lipid soluble, they are highly toxic, they readily cross the blood-brain barrier, hence there will be most of central nervous system manifestation. You will not find the patient as cool as organophosphorus poisoning. Here the patient mostly will be unconscious and status epilepticus, continuously having seizures, not responding to regular medications. All these scenarios going to be in the organochloride poisoning compared to organophosphorus. Remember, organochloride poisoning is the central nervous system problems where patient will have status epilepticus, not responding to any common drugs, and moreover the mortality rate is actually much more high than anticipated. What are the organochloride poisons you have? Dichloro, diphenyl chloroethane, DDT. This has got a most chance of transdermal absorption of this one. Hexachlorocyclohexane, where the benzene hexachloride is one of the component. And third is cyclodienes. Remember, the cyclodienes are very worse. Endrin, dendrin, endosulfan, because in the recent practice the endosulfan is having a most mortality rate in among the organochloride poison, because whenever a patient comes to us, he has taken endosulfan, then we say this is not going to survive because of his higher central nervous system toxicity. He will have continuous seizures and will have a respiratory failure, and ultimately he will die. And next is chlordipone and toxaphene. They are the 5 major organochloride poisonings which have to be remembered. I request you to remember one thing. These are the high endrin, dieldrin and endosulfan. These are the 3 major culprits among the organochloride poisoning, which is causing most number of deaths among the poisoning patients. But this is a simple scenario introduction about the organochloride poisoning. Now, how this organochloride acts, what they do in our body, that we have a lot of problems with this thing. So, usually organochloride poisonings, the mechanism of action is acts on GABA receptors. What do you mean by GABA? GABA is a gamma amino butyric acid. GABA is specifically a neurotransmitter which will mostly act on GABA receptors. How many types of GABA receptors we have? GABA A and GABA B. Gamma amino butyric acid, the neurotransmitter which usually acts on the receptor. How this GABA is related to organochloride poisoning? It mainly enhances the action. It prevents the chloride channel opening.